How much menstrual blood a woman loses can be different for everyone. Some women might have a light flow while others have a heavier flow. This amount can vary a lot from one woman to another.
Menstrual flow, it varies from person to person, it varies from month to month, and it also varies during the same cycle itself. On some days, woman might be having a light flow, on other days, she might be having heavy flow. On an average, the menstrual flow, that is the menstrual cycle, it should last up to 7 days. If it is for more than 7 days, if she is passing clots, and if she is soaking one tampon or one pad every hour, then also we consider that this is heavy bleeding.
The amount of blood can vary a lot from woman to woman. Women can tell if their bleeding is abnormal, if it's much heavier or lighter than usual or lasts too long.
There are many factors which affects the menstrual flow, right from the genetics, the ethnicity, the hormonal imbalance, the lifestyle factor, and the health condition of that woman. By hormonal imbalance, I will just give few examples like if you are having thyroid disorders, if you are obese, or you are suffering from polycystic ovarian syndrome. Health conditions, I mean if you are having anemia, if you are having endometriosis, if you are having any other health condition. And by lifestyle, I mean the eating disorders, that is anorexia nervosa, if you are doing too much of physical activity, if you are all the time under stress. So these are just common examples. If you want to know whether your bleeding is heavy or not, if it is for more than 7 days, and in ml, I would like to give you that on an average 80 ml per month is considered as normal flow. Now, in your routine day-to-day activity, how you can calculate whether you are bleeding for more than 80 ml. So, your one regular tampon soaks up to 3 ml. If you are using a super saturated tampon, that soaks up to 12 ml. Your regular pad, it soaks 5 ml. And if you are using a pad which you keep overnight, and if it is fully soaked, then it contains 15 ml of the blood. So this is how you can calculate how much you are bleeding in that cycle. And if it is more than 80 ml, you have to go to your gynecologist for further evaluation.
These days, women dealing with severe menstrual issues have many options available beyond non invasive treatments.
Because I see many women who come to me and they just want hysterectomy. They want to get rid of their uterus. Remember, removing uterus is the last option when you are having abnormal bleeding or when you are having heavy bleeding. Why I am saying so? Because you are just perceiving that if you remove the uterus, it will solve all your problems. Remember, you will not get only the periods, it will solve only that problem. But you don't know how many other problems your operation will bring into your life. It's a major surgery. If you remove your uterus before the age of natural menopause, that is 50 to 52 years, then you will be having the symptoms of premature menopause.
Understanding your menstrual flow and knowing what's normal can empower you to take control of your health. By being informed, you can make better decisions, seek the right help, and find solutions that work for you.